this is just a real sticking point for me, like the food inequity. You can buy garbage that you should not feed to a rat at a cheaper rate than lettuce. And that really is bothersome. But my second question, my observation was this, but my question was, so you've talked a lot about the behavioral piece, the CBT, but you started off by saying how there's the set point and you metabolically then start resisting.
Yeah.
Can you, again, because you can clearly explain the whole metabolic response in about 3 minutes, could you talk about that? Because that's not necessarily attached to cravings.
There's 3 active theories about how the brain defends against fat loss. What we do know is the brain defends against fat loss. If our ancestors lost weight, it was not to look good for a wedding or because of bathing suit season, right? It was because the food supply was interrupted or illness. And so we have a system to defend against fat loss, really so that we are fueled well so we can pass on our genes. That's actually the current understanding. So yes, we have a sense that whatever the highest weight someone gets to, and Sean, you know this isn't clear. We've talked about maybe scarring in the hypothalamus, not necessarily clear how this happens, but the brain will bookmark. I always feel like the bearer of bad news, right? We'll bookmark the highest weight we get to, and then the further you move down from that weight, the stronger 2 things happen. There's only 2 ways the brain will defend against fat loss. It'll defend by, the primary mechanism is increasing appetite. The very thing we just talked about that we face, that is the primary central symptom of struggling with weight, gets stronger. That's not fair. Excellent for 20,000 years ago. Perfect, actually, or 40 or 80. And then also our metabolic rate will slow down, which is a secondary effect. The appetite effect is much stronger. And so do we have a way to defend against this? Classically, we could say we cannot change the set point or settling point. But now, in theory, at least qualitatively, the 2nd and 3rd levels of treatment do that. So we see if someone is on a very effective anti-obesity medication, we see them having a dampened defense against weight loss. So they're able to go further and find a lower weight where they're not subject. Think of the whole appetite curve just shifting down. So they'll still lose weight and it'll slow and it'll stop somewhere, but it'll stop much lower than otherwise. And when they're at that lower spot, they'll have more defense against the brain's effect of trying to get them back up. So surgery does the same. So gastric bypass surgery, we see the neurological. Some people think that gastric bypass surgery is mechanical or physical. It's neurobiological. The changes that happen from gastric bypass surgery change the level of cravings. Put someone in a MRI and show them pictures of food after surgery, their brain is going to respond completely differently and less aggressively to food pictures than pre-surgery. So we see the changes again. Obesity is a brain-centered condition. This is where all the genes act. And so, yes, it's a great question, but it's also fun to say we don't exactly know how that happens. A guy, if you want to read about maybe the best thinker in this area right now is John Speakman. He works in China, and he puts out papers every 6 months or so. John Speakman is a great researcher and writes well about this concept and also points out that we don't really know the answer. Was it self-sabotage or was it biology? Was it actually the normal response to weight loss that will happen in your brain that counters weight loss with increased appetite? 'Cause that's an important distinction, because if it's self-sabotage, that means it's your fault. It's right. Is that part of that automatic storm of thoughts that come in a moment of seeing the scale go up or having an off-track day? Are we back to the resilient subject? See how that kind of sneaks in? That's really cool. And I would invite you to consider that, no, the weight loss was yours, but the weight regain is biology. That's the system. That's how it works. And to answer your question of can we, aside from surgery or medication, I kind of want to double down on effective anti-obesity medications because maybe not everyone knows this, but we are in a particularly very exciting time with the onset of safe and effective medications that will do exactly really what you're asking for, which is to dampen the brain's response to try to get me back up, freeing me to think less about food and be less hyper-responsive to cues and to have lower cravings. And if this is a chronic disease and if medications are safe and effective for long-term use, then we might very well be in the direction, thankfully, in 2022, finally, where we actually can support. Now, not everyone is interested in medication, and I get that. I get that. And so behavioral therapy is certainly an evidence-based method. We just went through behavioral therapy. I already invited you to think that you don't self-sabotage yourself and it's biology that's causing weight gain. So there's lots to work on in the behavioral field. But medication is, if people don't know that, medication is currently, as a clinician who's worked for almost 19 years in this field with only behavioral tools, to have effective and safe medication for patients, it's a very positive experience for the absolute great majority of them. And so, and it's only becoming medication is only becoming more effective. We're kind of in a stage, and this might sound foreign to you, but we've been at this stage with anti-obesity medications for the last 15 years, and right now it's just like going like this. It's just going up in safety and effectiveness.